You all set, my friend?
Yes, sir.
Okay. So as I said, you're going to feel me touching you with this, but the whole idea is to get things in without the feel. So now we're inside your knee. And if you look up above, you see your patella. And you look down below and you see the groove where the patella tracks. Now I'm going to take a little bit of fluid just to inject in there, and it helps clear the view up a little bit more. And so just like we talked about, when that's some pretty severe arthritis. There's a big bone spur right there, and we're also looking to see about inflammation. Now what we're going to do is we're going to slowly bring your leg down, and you relax, just let me move you. So now we're looking as your patella goes down, and you see the irregular spots there. So that's the arthritis. We're going to back this up just a little bit more, and now we're going to go down and look like this. And sometimes we have to redirect it, so I'm going to take this off for a second. And we're going to let the knee bend down just a little bit more. How you feeling, man?
Good.
Good. Okay. So now we're looking inside at where you're going to go over to the weight-bearing surfaces. So there's the spot where your ACL was. And we're going to change one more time, and we're going to look at just bend your knee down just a little bit more. Excellent. So this is your lateral compartment. And unfortunately all of that should look smooth, but the good thing is I'm not seeing any loose fragments. So there's some remnants of, you see the fibers going up and down like that. That's part of your ACL. And going over to here is the medial compartment. You see there's some small fragments moving around in there. So I think the thing with this, the pink there is exposed bone.
Okay.
And so what this means is that doing a scope, taking you to surgery, exposing you to anesthesia to try to clean all of this out is going to be a waste of time.
Okay.
And because I can move you with this, we wouldn't get that view from an MRI.
Mm-hmm.
So what I'm going to do is we're going to inject you with a little cortisone. We're going to talk a little bit about activities, exercises, but this helps us confirm what will work and what won't work.
Okay.
Because one of the things we're trying to do in the medical field is not waste people's time or money on things that don't have a chance.
Yeah.
And if you look here, you see the white around there?
Yes, sir.
That's cartilage. So sometimes if you were to get an x-ray, that cartilage would artificially prop up the joint space, and you'd say, oh, these x-rays don't look too bad. He doesn't have bad arthritis, but it's missing all of this here and here where it's worn down to bone.
Okay.
So I'm not happy to tell you all that, but at least we know what we have, and so we're not going to go barking up the wrong tree managing this in the future.
Okay.
Okay? So what we're going to do is I'm going to remove the fluid that's in there. That's helpful to make it less uncomfortable for you later on. And then what we do through the scope is I'm going to inject a little cortisone. Now, one of the things that's nice about doing this, and you can actually look at the screen, we know we're not injecting it into soft tissue or in the tendon. It's going right into your knee joint because we're in your knee joint.
Gotcha.
So if you look there, you can see that's the cortisone going in there. So here we go. I'm going to pull this on out. We're going to let you relax a little bit.